At Discovery, our core purpose is to make people healthier by enhancing and protecting their lives. This purpose is fundamental to all we do at Discovery, and as I take you through the product enhancements, you will see evidence of our core purpose. Discovery Health has had a strong financial year and allows our members to remain confident in the scheme's ability going forward. What we have seen is that our member base has grown significantly, covering close to 3 million lives, equating to 56% of the market share in the open medical aid market, which is currently made up of 21 schemes. We maintain high cover ratios as our members experience high cover ratios for in-hospital claims of 96%, speaking to our scheme's sustainability while paying out these high-cost claims. We maintain a solvency ratio of 27.4%, comfortably above the 25% requirement as regulated by the Council for Medical Schemes, and hold 17.6 billion rand in our reserve account. So what this means for our members is, in the case of something catastrophic coming into the country, we're able to cover our members comfortably without compromising any of the service that they are accustomed to. As we do every year, we'd like to update you on the drivers of medical inflation, these being the factors that we have to consider when introducing a premium change at the beginning of the new year, bearing in mind that providing quality private healthcare to our members while ensuring the sustainability of the scheme being our main focus. Firstly, we consider Consumer Price Index, which is the cost of living, which currently sits at 4.5%. Then we add on 5.75% on top of that for tariff increases. These are the charges that healthcare providers charge, and we see this going up year on year. We then get what we call the demand side. This is the increased usage of health services by each medical scheme member relative to the year before. This is due to things like aging, the scheme getting older, and an increasing prevalence of chronic disease. If we look closer, we see that we get about 1% for aging and about 3.5% as a result of disease burden. If we look at the trends here, we can see that the scheme is aging about 4 months every year. For each year that the scheme ages, you get claims going up by about 2.5%. Because Discovery Health ages less than a full year, that adds about 1.1% for aging. Then if we look to the right of the slide, we can see significant increases in the number of members who have chronic conditions. It's gone up from about 20% 6 years ago to about 26% now. We see increases in diabetes, high blood pressure, but this is a global trend, and this speaks to lifestyle, where members are not exercising enough, excessive smoking, alcohol consumption, and incorrect nutrition. This is leading to a very significant increase in chronic disease. The average chronic member claims 3.5% more than non-chronic members. Chronic members are admitted to hospital 2.6 times more than non-chronic members. As well as for every newly diagnosed chronic member, we need about 3 members to join the scheme. In addition to the demand side, we have supply-side inflation. This speaks to new technologies, new hospitals, new biologic medication, and this adds on between 2 to 2.5% per year at the moment. If we look at the supply side slide, this will show you the impact on the medication. Between 2008 and 2018, we had a 400% increase in the amount of members claiming more than 100,000 Rand a year on medication. Looking to the middle, the cost of those high-cost claimants went up by 500% to 1.8 billion Rand. And you can see a large amount of members claiming for conditions such as rheumatoid arthritis. That's one of the conditions where we have very expensive medication. 10 years ago, we had 239 members claiming, and today we have over 1,300 members that are claiming for that condition. Looking at all of these trends, this adds up to a total inflation that we see of between 10.5 to 12.5%. If we break down the utilization per plan range, we see a very high claims ratio on the upper end and lower end of the spectrum, illustrated by the gray bars. The executive, comprehensive, coastal, and the lower income bracket on our KeyCare option are all running with inflation well above the total premium. If we look at the executive plan as well as the comprehensive plan, we see a claims ratio of 125% as well as 104%. So what this ideally means is that members on these plan types are claiming far more than what they are collecting in premium. On the other hand, our plans illustrated by the blue bar, being the Priority, Saver, Smart, Core, and other KeyCare options, come in with much lower inflation rates. I'm pleased to tell you that we are able to bring down this inflation by firstly looking at our risk management. Through fraud analytics, where we were able to recover fraud close to 500 million rand, contract negotiations with our providers, as well as our risk management tools, we're able to decrease the contribution increase by 1.2%. Through Vitality, a world-renowned wellness-based program, which keeps our members young and healthy through engagement, allows an additional decrease of 0.4%. Bringing it all together, our projection is that the required contribution increase will range between 8.9% to 10.9% for next year. I'm happy to announce that for 2020, we at Discovery will have a weighted contribution increase of 9.5%. Members that are on the KeyCare Plus plan, being the lowest income band, will experience a 10.9% increase, and members that are on all other KeyCare bands and options will experience an 8.9% increase. This will affect 60% of our member base. Looking through the rest of the presentation, which would be KeyCare focused, we're still proud to offer members with the most comprehensive plan range looking at KeyCare in the market. On our KeyCare option, members would be able to experience unlimited private hospital cover, provided that they use a hospital on the KeyCare network. Members will have access to the chronic illness benefit, made up of the 27 chronic conditions, where members are able to utilize our MedExpress pharmacy delivery service, where we're able to deliver members' chronic medication to their door, or alternatively, contact members' Discovery pharmacy, ask them to package the medication for members, and members are able to go in and collect the medication. Members would also have access to a limited number of consultations relating to their chronic illness, which all forms part of the chronic basket of care. Members on the KeyCare series will also have access to the screening and prevention benefit, where members would be able to have their mammograms, pap smears, your blood pressure, glucose, cholesterol, body mass index, and HIV testing done at one of our network pharmacies or through a wellness day. Members would also have access to our maternity benefit, which is made up of a limited number of blood tests as well as consultations that mum-to-be can make use of all the way up until baby is 2 years old. If we look at the KeyCare updates for 2020, when we looked at the usage on the KeyCare casualty benefit, we found that about 3% of our KeyCare members had more than one casualty visit in 2018. The balance of the members had over 20 casualty visits in 2018. Our KeyCare option offers members very rich day-to-day benefits, offering our members unlimited consultations at 2 selected network GPs. So bearing this in mind, we have now made a change to the KeyCare casualty benefit, where the benefit would now be limited to 1 elective casualty visit in 2020. If we look to the right of the slide, you're able to see updates to income band thresholds, where the lower threshold will remain unchanged and the upper threshold will increase by 5.7%. One other change or something to mention on the KeyCare plan for next year is that the KeyCare mobility benefit will remain as is for 2020. If we look at the KeyCare series holistically, we have a KeyCare Plus, a KeyCare Core, and a KeyCare Start option. Again, these allow members unlimited hospital cover in our KeyCare hospital network. Members on the KeyCare Plus would be able to select 2 doctors, a primary and a secondary GP within our network list. And as long as members utilize either of these 2 GPs, they will have unlimited consultations. When member does get to the 15th visit, member would need to call us to authorize visits going forward. Members would have access again to the chronic illness benefit, cover under the maternity benefit, as well as cover for basic blood tests, basic x-rays, and medication, which must be part of the formulary under the KeyCare Plus and KeyCare Start plans. The KeyCare option is a very network-driven based series, as well as this plan will work on your income. So once member opts into this option, you would see what income band you fall into, and that will determine your premium for next year.